Huh. Hello, this is Dr. Trivedi, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. I am Chris Hemsworth, 38 years.
How may I address you?
Please call me Chris.
Okay, Mr. Chris. Today we are going to discuss about your health issues. Is that all right?
Yes, doctor. I want to know what is happening with me.
Okay. And during our discussion, I might take down some notes, which will be strictly confidential. Will it be okay?
Yes, doctor. I have no problem with that.
Okay. Mr. Chris, can you please tell me on to here today?
Actually, doctor, for last couple of days, this should be about for last 2 weeks. I feel that I am not feeling well. I feel that I have become somewhat erratic. I cannot tell you that exactly how I feel. And for last about 1 week, I feel that I have raised temperature. I have fever, and for that I initially took paracetamol, but that didn't help me. Then I visited my GP. He thought that it would be pneumonia because I had some cough for also during that time, and he prescribed me amoxicillin for that, and told me that it would probably help me. But after taking those medication for about 5 days, this didn't help me. So I again visited him, and he thought that there might be something abnormal. So he sent me here.
Okay. I will try my level best to find out what's actually troubling you. Okay, you told me that you had some you have been feeling some fever or for some raised temperature for the last 1 week. Well, can you please tell me that have you measured your temperature
Yes,
ever?
doctor. About 2 to 3 times I have measured it. It is around 100 degree Fahrenheit, 100 or 105, not very much.
Okay. Yeah. Okay, I get it. And is it present all the time? This fever raised temperature?
Most of the time, and I think it is more at night.
It's more at night. Have you ever tried with any medication to of this temperature?
Yes, doctor. I took paracetamol, but that didn't help me much.
That didn't help you much. Okay. And is there anything else that makes you feel better of this temperature?
No,
Okay. Do you have any chills and rigor? Have you noticed?
no.
Okay. Any night sweats? Have you noticed?
A few, quite a than unusual. Yes,
Unusual. Okay. And you do you have to change your clothes due to this night
sometimes,
sweats?
sometimes.
Okay. May I know that have you noticed any change in your weight that sometimes that your clothes are getting looser or anything like that?
Yes, doctor. That is also a new problem for me. For last 3 months, I noticed that I am losing some weight. Initially, I thought that it is a good sign that I am being fit, but that was totally unintentional. And even I take much amount of food, but I even losing weight. And I think I have lost around 5 kg over the last 3 months.
Okay, so it is completely unintentional. Am I right?
Yes, doctor.
It's yes. And okay, and well, have you noticed any lumps and bumps anywhere in your body?
No.
Okay. Let me get back to your some chest problems that you have told me that you told that you have had some cough recently. Well, can you please tell me that when did you first notice this
For the last 1 week.
for the last 1 week? May I know that is it dry or do you have produced any phlegm?
No, no phlegm. It is dry.
It is dry. Okay. And well, can you remember that did it these episodes came along suddenly or did it develop gradually?
Cough is not so much severe, and sometimes I feel bouts of cough. Then I feel good.
You feel good. May I know that how frequently do you feel these episodes, coughing episodes?
4 or 5 times a day, and
4 or 5
when I work or when I walk for a while, then I feel it most. But during rest, it is usually never.
during rapid delivery. Okay, that's all right. Okay, and may I know that is there anything that makes your cough worse
I haven't noticed it.
from this exercise, walking?
No, I haven't noticed anything.
Okay, anything that makes you feel better?
No, I haven't noticed.
Okay, and may I know that do you remember that do you ever have coughed up any blood?
No.
Have you noticed? Okay, that's all right. May I know that do you feel any shortness of breath?
Yes, doctor. That is a new thing for me. That for last 1 week, around 1 week, I noticed that I am being shortness of breath after working for a while. Previously, I was working as a sales manager, and I have to do a lot of hard works, and I had to work for a mile to mile. But this time, I noticed that even I walk around, suppose 100 meter, I feel shortness of breath. And for last few 2 or 3 days, I noticed that even I go to my washroom, then I am feeling that I am becoming short of breath.
Yes, okay, I can get it. And may I know that uh, may I know that do you have to use extra pillows at night to reduce this shortness of breath?
No.
Okay, have you ever noticed any swelling in your legs
No.
recently?
No.
Okay, and have you found out anything that makes you feel better of this shortness of breath?
Taking rest.
Taking rest, and anything making it worse apart from this walking or doing
No,
any.
I haven't noticed.
Okay, well, may I know that have you noticed any racing and pacing of your heart?
No.
Okay, any chest pain?
No.
Okay, any tightness of your chest?
No.
Any noisy chest?
No.
Okay, any runny nose?
No.
Okay, and may I know that is this the first episode that you are experiencing this cough or shortness of breath, or has this occurred before as well?
No. This is the first time.
The first. Okay, and may I ask you some other questions now? Do you have any headache?
No.
Any changes in your vision?
No.
Any soreness in your mouth?
Previously, doctor, I had recurrent soreness in my mouth.
Okay. Well, may I know when did this first occur?
This is for about 5 to 6 years, and I usually have 2 to 3 times a year that shortness in my mouth comes, and they are quite
Okay,
painful.
they were quite painful. Okay, and did you seek any medical attention any times for this problem?
No, doctor, it went away after a few days, so I didn't seek any medical attention for that.
Okay, okay. May I know that do you have any joint pain,
No.
any back pain,
No.
any rashes anywhere in the body?
That is not this time, but I had some problem in my private parts.
Private.
There,
Okay,
there were some rash, and that was also quite painful, and that happened about 3 or 4 times over the last, I think, over the last 4 years.
okay. And did you seek any medical attention for that as well?
Yes, my GP prescribed me some viral medication for that. He told me that it is caused by virus.
Okay, and did it go away after taking that medication?
Yes, doctor.
Okay, I can get it. And any rash anywhere else?
No.
Okay, you told that that was painful, but may I know that whether that rash was flat or raised?
Not rash. That was quite some blistering type of rash, and it was some with fluid filled in it.
Fluid.
Yes.
Okay. Did you ever pass any pass in any
No.
discharge from it?
No.
Okay. Any bleeding?
No.
Okay. Any itching? Did you feel?
No.
Okay. And okay. And may I know that do you have any difficulties in your swallowing?
No.
Any difficulties in speech?
No.
Any weaknesses in any parts of your body?
No.
Okay. What about your water work? Has it been all right?
Yes.
Okay. And have you ever passed out any blood in your water work?
No.
Okay. And do you feel that you have to go frequently, more frequently for water work, or is it all right, the frequency?
I think it's all right.
Okay. And what about your bowel movement? Is it that all right?
No. I I I
May I know more?
I have been I have some problem with my with loose motion. That is around for about 6 months. And I have visited my CP. He told me that I am a sales worker and I had to walk around and I have to lead a stressful life. So it is an IBS.
It's an IBS. So, have you been prescribed any medicine for that?
He gave me some medication for my anxiety. That is
Mhm.
called amitriptyline. I am
Mhm.
taking
Uh,
that.
and how is the response?
No, I didn't find any difference.
It's been all the same. Okay.
Yes.
May I know? Well, can you please tell me that how many times do you have to open up your bowels?
About 3 or 4 times a day.
Okay. Anything that may have you ever noticed any blood?
No,
Okay. Is there anything that makes you feel better or
no,
worse?
doctor.
Any relation with food? Have you noticed?
No,
Okay. Okay. And may I ask you that do you have any significant past history of medical history of any diseases?
no, doctor. I am quite well.
Okay. Well, do you have any history in your family with any chest diseases or any long-term disease?
No, doctor.
Any history of sudden death?
No,
Any allergic to any medication?
no.
Well, do you take any medication up recently? Now?
Yes, doctor. I am taking a treatment for a long time, and also taking
Sorry, which drug?
amitriptyline
Okay, okay,
and
okay.
amoxicillin, and also
Yes, yes,
paracetamol.
yes, yes. Okay. Well, have you taken any over-the-counter medication?
No,
Any herbal medication?
no,
Any blood transfusion through your blood channels?
no.
Trans- okay. Well, may I? I'm okay. I will like to ask you some personal questions, but you have to find out the cause. Do you take any recreational medication?
Yes, doctor. That is my
I'm
bad.
very sorry to ask, but may I know which medication?
Sometimes pethidine, sometimes cocaine.
Yes, yes. May I know by which route?
Doctor blood center.
Okay. May I know that do you share any needle blood channel needles with
Uh,
anybody?
Truly speaking, doctor, yes, I sometimes need to share because I cannot afford all the cost.
Yes, yes, I'm sorry to know. Well, may I again ask you some personal questions? Do you smoke?
Sorry.
Do you smoke?
Yes, doctor.
How many sticks for how long?
Uh, that is about 10 to 15 sticks per day for last 20 years.
Okay, actually, smoking is very harmful and it can also add to your present problems as well. So, I would like you to stop smoking. If you want, we can refer you to smoking cessation clinic. Will that be all right?
Okay, doctor.
May I know, do you drink alcohol? Do you drink alcohol?
Occasionally.
Okay. And may I know that it's again very personal question, but may I know that are you living alone or with? Do you have any partner?
Living with my partner for a long time.
Okay. May I know that is the partner a male or a female?
Male, doctor.
Okay. I'm very sorry to ask, but may I know that do you use any protective measures during intimacy?
No.
Okay. And may I know that have you been to any casual relationships recently or previously?
Previously, I had
Okay, I'm sorry to know, but sorry to ask that. But may I know that when was the last relationship you had?
about 9 years back.
Okay, and may I know that have you been to any travel to any country recently?
No. 2 minutes
Okay,
remaining.
okay, okay. And may I know that what do you do for a living?
I'm a sales worker, doctor. I told you.
Yes, and yes, and are you well supported financially and socially?
I think I can manage myself, doctor, but not something that I am very spend a lot like that. But I can manage my life.
Okay, okay. Yes, yes. Okay, that's all right. Well, may I know what your concerns are?
Doctor, is this something serious? Do I have any heart problem because I am not responding to antibiotics?
Yes, I can get it. Actually, at this moment, I have to examine you thoroughly and also assess you by making some by doing some tests and scanning tests. And however, as long as I have taken history from you, there might be some possibilities. The most likely possibility is that your defense system may be a bit weak now. Okay, there might be many reasons for this. We will actually be sure about it after doing all the tests. But regarding that, I'm sorry to say, but regarding that, your lifestyle, that you take some medication, recreational medication, and also your private life, uh, I fear that one of the causes that might be that might be HIV. It might be. I'm not sure at this moment, but we have to bring it into consideration as well. Are you getting me?
Yes, doctor.
Okay, and actually, we might also do some tests for that also, for that HIV also. Are you with me, Mr. Chris?
Yes.
At this moment, I would also like to ask you that have you is your partner all right, or has he been facing any problem symptoms or any problems with his health?
He's fine.
He's fine. Okay, that's all right. And also, I would like you to stop taking recreational medication because it is very harmful for health, and also smoking as well. And it is also better that you take some preventive measures while being intimate. And we will get to you as soon as possible after after doing the tests. Are you with me, Mr. Chris?
So you are going to do this type of that is called ACV test.
At
Can
this moment, yeah, yeah.
okay, you can continue.
Okay, at this moment, at first we will do some blood tests and the scanning test, and we will also consult with our consultant and our local infectious disease team. And after that, we will have to decide whether we will run the test. And in that case, we will sit with you again so that you are well informed about all the pros and cons of the test. Will it be okay, Mr. Chris?
Okay.
Okay. Any more concerns?
Now, just one thing that do I need admission because I am becoming very short of breath. I cannot even do my job.
Yes, regarding your condition, uh, I think it would be better that if we keep you under close observation for the time being. Okay, until we do some very basic tests. Okay, to know whether you are fit for discharge or not. Are you getting me, Mr. Chris?
Okay.
Okay. Any more concerns?
No, no.
Okay. Thank you.
So what do you think? What is happening with him?
Uh, well, I think that the condition, the symptoms might be occurring due to some secondary immunodeficiency. Okay, and the most likely cause I think here will be might be HIV. It's regarding his exposure history, his uh, his drug abuse history, and also regarding his history of altered bowel habits recently. So and weight loss, altered bowel habit,
What
oral
is your
ulcer.
primary diagnosis for his breathlessness or his
Uh,
fever?
for his primary breathlessness, his breathlessness, I think uh, he might be suffering from pneumonia, and also some community acquired pneumonia, and also he might be suffering from pulmonary embolism, and also from pneumocystis carinii pneumonia as well. I think these are the main diseases.
Do you think tuberculosis can be a cause?
Yes, yes, yes. Tuberculosis can also be a cause. I'm sorry.
Okay. And will you consider carcinoma of the lung?
Yes, it should also be considered.
Okay.
Okay,
So
yes, yes, this should also be considered. TB is a carcinoma of lung. Lymphoma also, although he doesn't have any lumps and bumps.
okay. So suppose he's suffering from pneumocystis pneumonia. How will you investigate him?
Okay. First of all, I will have to do some routine blood tests, including CPC, ESR, CRP. Then I will also I will have to do some blood count level, including CD4 level, CD8 level. Then I will have to go for some chest X-ray, chest X-ray PA view, and I might have to go for some bronchoalveolar lavage and bronchoalveolar lavage, and also I will have to do oxygen cell. Sorry, arterial blood gas measurement and SpO2. I think saturation of oxygen level both in normal and on exertion. I think these will be the main tests for pneumocystis carinii pneumonia. And
What we expect on X-ray of this patient?
okay, if I suspect pneumocystis carinii, I think the X-ray might be a varied presentation. It might be normal totally, or there might be a bilateral opacities. I think bilateral opacities in the lung field.
Okay, that is fine. So how will you manage a case of pneumocystis carinii pneumonia? Suppose this patient, how will you manage this patient?
Yes, for pneumocystis carinii, I think I will have to go some special medication, some special drugs like sulfadiazine, pyrimethamine, I think. Huh. And if, I might also go for if it is intolerant or doesn't respond, I think I also might have to go for pentamidine. And if he's hypoxic, I think steroid might also be useful in this kind of patient. And if PO2 is less than
Hypoxic.
720,
The patient feels shortness of breath on exertion.
yes, I think steroid should also be given in this case,
Okay, so,
along with oxygen.
so you want to admit this patient, then you want to manage him.
I would like to admit this patient at the same time of
Okay, so
running the.
so you want to admit this patient, and then you want to go for the steroid, and then you want to go for the sulfadiazine and pyrimethamine, otherwise pentamidine.
Yeah.
And after that,
Uh, After that, actually, I will have to consult with the local infectious control team and all those teams whether I would carry out the specific HIV tests or not. Okay, I think that is important because if he is HIV positive, I will have to start triple therapy. Sorry, I will have to start highly active antiretroviral therapy, heart therapy. So
okay,
I will have to go for that, I think.
okay. This patient, okay, you have done good.
Okay.
This patient had also a diarrhea, so you needed to manage him for that also.
Yes.
What would be the cause of diarrhea for this type of patient?
Uh, yes, there can be a lot of causes. Actually, there can be giardiasis. There can be, I think, uh, some. Okay, I think mycobacterium also can be a cause, and also some common causes. I think I just have forgotten names of the viruses actually at this moment. Some very common names I have just forgotten. Okay.
Okay, that is not a problem. So in the history taking, I think, yeah, this was fine. This was a good history taking. That was something that you were somewhat haphazard. And
Yeah.
initially, in that, then after that, you took the past history. After that, in the drug history, you were haphazard also this time. You were just asking some questions, and then we went to the family history. Then again, you asked some drug history case question. In the personal history, you have done well. You have asked almost everything. And also, I think you should have asked about pet.
Sorry.
Pet.
Pet. Yeah. I just
Extrinsic allergic alveolitis. That is also present like this
yes,
way.
very important. Okay. Yeah.
And also he has some issue with his job because he cannot manage his job. He told you, so you should have do something for his job, I think.
Okay. Yes, that's right.
Otherwise your everything was fine just in the diagnosis, your primary diagnosis, then you should go for the secondary diagnosis. Then if you think that secondary is causing by any tertiary diagnosis, then you should go for that. Just like I think it is a case of pneumocystis pneumonia secondary to HIV or acquired immunodeficiency syndrome.
Mm.
I have my differentials are that tuberculosis, lymphoma, or
Mm.
whatever.
Mhm.
Okay.
Yeah. So, what about the investigation part? Well, where I right?
Yeah, just go for the baseline investigations and what do you expect on the baseline investigations? White blood cell
Okay.
count, there may be there may be leukopenia or
Mm.
lymphopenia.
Mm. 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 Mm.
Just telling that there may be lymphopenia.
Mm.
ESR may be
Mm.
raised, CRP may be
Mm.
raised.
Mhm. Okay. Mhm. Okay, I think that's good. That's and okay. And other tests. When I added that, I will have to consult with the infectious control team at first. Then we will decide whether we do the test or not. Is that okay?
You can decide on your own that this patient needs ACV or not. And also when you are talking this patient, you already heard the patient that about I am considering my life, your lifestyle. Who are you to judge his lifestyle?
Okay.
You
Okay.
have heard him.
Okay. Well, may I know that when I was talking about his depression medication, I think that is also a lifestyle issue. Well, may I tell about it, or uh, what?
Okay,
How can I counsel him at that point?
okay, you are suspecting that, yes, I am suspecting that there might be some problem with your defense system, and I am suspecting that there are a few causes of this problem with the defense system. That is, sometimes it may be caused by a virus we call HIV. Do you have any idea? No, don't have any idea. Okay, this is actually a virus that can come through needle sharing.
Mm.
That and we I am suspecting. So you are not just
It's better to
believing for a
use
secure
the
life.
word directly. Am I right? It is better to use avoid the word directly. That lifestyle. So rather, it's better to
Yes,
use these words so that he might
yes,
understand it. Okay.
yes, and that was you're talking was like that. You are blaming my lifestyle, my sexual history, like that.
Yeah, yeah, yeah. So I think I should have asked in a much more
Yes,
vague pattern.
there are few possibilities for HIV that is relating to some needle sharing that can cause this type of
Okay,
disease.
okay, that's all right. That's I
So
think that.
we may need to run the test.
Hmm.
Do you have any? Do you want to run this test, or do you want to take time to know better, or we will discuss about
Mhm.
this test better after this discussion?
Okay, so I will. I think that's very good, nice to know. That's very helpful for me. Okay, and any more topics? Do you think any more things to be discussed?
Otherwise, you have discussed everything well.
Well, I told that there might be some possibilities like it can be due to community acquired pneumonia as well. What, am I right? I think that it's right. He might be suffering from community acquired
Yeah,
pneumonia as well.
he can suffer from anything. Community acquired pneumonia, that is typical pneumonia, everything is possible. But according to his history, the main differentials come with.
Hmm. Yeah, yeah. With this FTCB, community acquired pneumonia. Am I right? Yeah.
Yes. Okay, fine. Thank you.
Okay, okay, thank you.